can say where the road goes, where the day flows, only time. And who can say if your love grows as your heart shows, only time.
Oh, it appears I have hurt my musculoskeletal system. Today, we will be talking about musculoskeletal conditions, and we have a special guest, Mr. Skeleton. He will help me show the musculoskeletal system. And before I forget, my sources will be in the description and the end of the video. I now need a wheelchair. I am quite sore. Let's get started then. Musculoskeletal conditions are conditions which affect your bones, muscles, and their related parts, like ligaments and joints. They are the most common chronic conditions in Australia. They are primarily cared for in the primary healthcare area, which includes GPs and family doctors. Back problems made up 31.4% of disability-adjusted life years. In 2011, this made it the third leading disease burden in Australia. 45% of the burden due to osteoarthritis was attributed to being overweight or obese. In 2011, around 17% of the burden due to back pain and problems was attributed to occupational exposures and hazards, falling, lifting heavy objects, etc. People who have back problems are 1.2 times more likely to be obese. 31% of people with back problems also report arthritis. It makes it the most common accompanying condition, followed by cardiovascular disease 30.9% and mental health problems 29.8%. 2 out of 3 people who suffer from back pain also say they suffer another chronic disease. Risk 1. Being overweight or obese. When you get fat, more pressure is applied to your joints, which in turn makes your joints more stressed, especially around your hips and legs. As more pressure is added on, those joints will grind more and more on each other. That's why 45% of people who are overweight or obese have osteoarthritis. Risk 2. Work. When doing any sort of work, you are using your muscles, even if you are at an office job. For example, when lifting a heavy box, which you should lift with 2 people or use a trolley, you will bend down and try to stand up when you have picked it up. You are using your back muscles and ligaments irresponsibly. If you do this over a period of time, you can strain them and you will experience back pain. Even if you're an office worker, repetitive motions over a long time can lead to carpal tunnel, which affects your ligaments and tendons. This is why it is also a part of the musculoskeletal conditions. Risk 3. Aging. If you are old, it is most likely you have done a lot in your life. All this can lead up to musculoskeletal conditions like arthritis. Past normal exercise and/or past injuries will have taken a toll on your joints over time. Risk 4. Socioeconomic status. When you are poor, you tend to get less education. This is mostly true for LEDCs, and you will go for more labor-intensive jobs. This leads back to the second risk. Back problems are very common in Australia, affecting about 1.7 million people or 8% of the Australian population. It is more commonly reported by men. The rates are highest among men aged 65 to 79. An estimated 728,188 Australians, or 3% of the Australian population, report having osteoporosis. The majority of these cases occur after the age of 55, and 82% of those reporting a diagnosis of the condition are females. 444,967 Australians report having rheumatoid arthritis. It is common in the older population, aged 65 or over. The prevalence of rheumatoid arthritis is higher in females. More than half of the people with arthritis, 1.8 million, also report having osteoarthritis. Osteoarthritis is reported more frequently by females than males. Unable to work for a short time. When you strain yourself, you will find it hard to do work, so you might take a day or two off work. Lack of mobility. When you do take that day or two off work, you will most likely find it hard to move or do certain actions. Pain. If you have arthritis, your joints will be sore from grinding, which will make it hard to interact normally. Not being able to take care of yourself, especially when you are older. With any musculoskeletal condition, it affects how you interact with your environment. When you get into late arthritis, your joints tend to lock up, which means you might need a helping hand to do certain things for you. Not being able to work at your original capacity. When you get a serious back injury, you will find it hard to do certain jobs like lifting heavy things, which can affect your employment opportunities. Not being able to be as social as before. Pain is always a problem when it comes to being social. Exercise. If you exercise, you reduce your chance of being overweight, which helps reduce your chances of getting osteoarthritis. Do not smoke. Smoking has been linked to an increased chance of getting rheumatoid arthritis, the most painful and horrible type of arthritis. Have a healthy diet. Similar reason to the first point, having this will keep you nice and fit. Have tools to help with work. Having a trolley, for an example, will reduce back injury chances dramatically. Websites such as www.arthritis.org can give you quick information on some musculoskeletal conditions, like arthritis. A medical facility like Mandra Medical Center are your primary locations to go to when you want help with your condition, as they are primary healthcare services because they contain GPs. A hospital like Fiona Stanley Hospital would be an emergency location, like if you needed surgery to help alleviate your condition. Well, this brings an end to our video on the musculoskeletal system and why you should take care of it. See you next time, kiddos.